Welcome. In this video, we'll explore the clinical management pathway for patients with cardiovascular and respiratory disorders, focusing on the essential steps every physical therapist should know. We'll break down the assessment process, how to set treatment goals, and the importance of outcome measures. By the end, you'll understand how to apply best practices and evidence-based interventions to optimize patient care. Let's start by understanding why a structured pathway is crucial for effective management and how it guides every decision from assessment to reassessment. Before we dive into the details, let's clarify our objectives. By the end of this chapter, you should be able to describe a clinical management pathway, define outcome measures, and understand the different levels of evidence supporting treatment interventions. These objectives will help you navigate the complexities of cardiopulmonary physical therapy and ensure you're making informed, patient-centered decisions. A clinical management pathway is a structured approach that guides physical therapists through the process of assessing and treating patients. It ensures that all aspects of a patient's condition are considered, from initial assessment to ongoing reassessment. This pathway is especially important for patients with cardiovascular and respiratory disorders, where conditions can be critical and complex. The pathway helps therapists identify which aspects of pathophysiology are reversible and amenable to treatment, and which require additional interventions to optimize function and prevent complications. Assessment is the foundation of effective clinical management. For cardiopulmonary patients, assessment includes a thorough chart review, patient interview, physical examination, and review of relevant lab tests and investigations. This comprehensive approach helps therapists gather all necessary information to identify reversible pathophysiology and other factors affecting the patient's function. Accurate assessment is ongoing and often the most challenging aspect of cardiopulmonary physical therapy due to the critical nature of these conditions. Let's break down the key components of a cardiopulmonary assessment. First, the chart review provides background on the patient's medical history and current status. The interview allows the therapist to understand symptoms, limitations, and patient concerns. The physical examination focuses on respiratory and cardiovascular systems, while lab tests and investigations provide objective data. Together, these components create a complete picture, guiding the therapist in identifying problems and setting treatment goals. After assessment, the next step is to generate a problem list. This list identifies aspects of the patient's pathophysiology that are reversible or amenable to physical therapy. It also highlights other factors that need to be addressed to optimize function and prevent complications. The problem list serves as the foundation for setting treatment goals and planning interventions. It's a dynamic tool, updated as the patient's condition evolves. Physical therapists often encounter a range of problems in cardiopulmonary patients. These include poor gas exchange, desaturation with exercise, poor cardiovascular function, myocardial ischemia, decreased cardiac output, pain, decreased mobility, poor exercise tolerance, retained secretions, recurrent infections, dyspnea, increased work of breathing, deep vein thrombosis, altered cognitive status, poor posture, decreased range of motion, poor nutrition, and decreased sense of well-being. Each problem requires targeted interventions to improve patient outcomes. Once the problem list is established, treatment goals are set. These goals should be directed toward reversing pathophysiology, preventing complications, improving overall wellness, and optimizing modifiable risk factors. Importantly, treatment goals should be client-centered, especially for outpatients and those with chronic illness. Negotiating goals with the patient increases their engagement and adherence to the treatment plan. Client-centered goals are essential for effective therapy. These goals are tailored to what the patient values and believes needs improvement. By involving patients in goal setting, therapists can enhance motivation, compliance, and long-term adherence to lifestyle changes and treatment interventions. This collaborative approach ensures that treatment is meaningful and relevant to the patient's life. After setting goals, therapists determine the best treatment approaches and expected outcomes for each goal. Treatments are prescribed using best practice principles, considering the highest levels of scientific evidence, patient needs, available resources, and the therapist's expertise. This ensures that interventions are both effective and feasible within the clinical context. Best practice means using the most effective techniques based on current evidence, available time, and equipment. Therapists must balance physical therapy interventions with other treatments and activities the patient is undergoing. This holistic approach ensures that therapy is integrated into the patient's overall care plan, maximizing benefits and minimizing risks. Dean's physiological treatment hierarchy provides a guideline for treating impaired oxygen transport. The premise is that being upright and moving is the position of optimal physiological function. The hierarchy prioritizes interventions like mobilization, exercise, body positioning, coughing maneuvers, relaxation, range of motion exercises, postural drainage, manual techniques, and suctioning. However, the plan should always be customized for each patient's unique needs. Mobilization and exercise are at the top of the hierarchy. The goal is to elicit an exercise stimulus that addresses acute, long-term, or preventative effects on the steps in oxygen transport. This means getting patients moving as soon as it's safe, which can improve cardiovascular and respiratory function, prevent complications, and enhance overall recovery. Body positioning is another key intervention. The goal is to use gravity to simulate being upright and moving, relieve dyspnea, and promote hemodynamic and ventilation perfusion effects. Proper positioning can also help with alveolar ventilation, mucociliary transport, and coughing, making it a versatile tool in the therapist's arsenal. Coughing maneuvers are designed to facilitate mucociliary clearance with minimal impact on airway compression and cardiovascular effects. These techniques help clear secretions from the airways, reducing the risk of infection and improving oxygenation. Therapists select the most appropriate maneuver based on the patient's condition and tolerance. Relaxation and energy conservation interventions aim to minimize the work of breathing, the work of the heart, and overall oxygen demand. These strategies are especially important for patients with limited energy reserves or those experiencing significant respiratory distress. Techniques may include breathing exercises, pacing activities, and teaching patients how to conserve energy during daily tasks. Range of motion exercises are used to stimulate alveolar ventilation and alter its distribution. These exercises help maintain joint flexibility, prevent contractures, and support respiratory function. For cardiopulmonary patients, maintaining mobility is crucial for overall recovery and quality of life. Postural drainage positions use gravity to facilitate airway clearance. By positioning the patient in specific ways, secretions can be mobilized from different lung segments, making it easier for the patient to cough them up or for the therapist to assist with manual techniques. This intervention is especially useful for patients with retained secretions or recurrent infections. Manual techniques, such as percussion and vibration, are often used in conjunction with body positioning to facilitate airway clearance. These hands-on interventions help loosen secretions, making them easier to remove. The therapist selects the appropriate technique based on the patient's needs and tolerance. Suctioning is used to remove airway secretions that have been mobilized centrally but cannot be cleared by coughing alone. This intervention is particularly important for patients who are unable to clear their own airways due to weakness, altered consciousness, or severe illness. Suctioning must be performed carefully to avoid complications. It's important to remember that not all features of oxygen transport can be altered in every patient. The treatment plan should always be customized based on the patient's specific condition, needs, and response to therapy. For example, in the intensive care unit, airway clearance may take priority over mobility exercises if mucus obstruction is causing atelectasis. When selecting treatments, therapists must consider the levels of scientific evidence supporting each intervention. Treatments are rated as grade A, B, or C based on the quality and consistency of evidence. Grade A is supported by well-designed controlled trials with consistent, statistically significant results. Grade B is based on observational studies or less consistent trials. Grade C relies on expert opinion when strong evidence is lacking. Grade A evidence comes from well-designed and well-conducted controlled trials, both randomized and non-randomized, that consistently support the use of a treatment. These studies provide statistically significant results and have a low risk of error. Whenever possible, therapists should prioritize treatments with Grade A evidence to ensure the highest standard of care. Grade B evidence is provided by observational studies or controlled trials with less consistent results and a moderate to high risk of error. While not as strong as Grade A, these studies still offer valuable insights, especially when higher-level evidence is unavailable. Therapists may use Grade B treatments when appropriate, but should remain cautious about their limitations. Grade C evidence is based on expert opinion when well-designed studies are lacking or results are inconsistent. While expert consensus can guide practice, it's important to recognize the limitations and potential for bias. Therapists should use Grade C treatments judiciously and always consider the individual patient's response. A lack of strong evidence doesn't mean a treatment is ineffective for a particular patient. Therapists must balance scientific evidence with clinical judgment and patient preferences. The goal is to use the highest level of evidence available, but always tailor interventions to the unique context and needs of each patient. An outcome measure is a tool used to assess change over time in an individual or group. It must have strong psychometric properties, meaning it's reliable, valid, and sensitive to change. Outcome measures help therapists evaluate the effectiveness of interventions and guide future treatment decisions. Good outcome measures are quantifiable, clinically available, practical, cost-effective, valid, and reliable for the population or condition being tested. They should closely relate to the problems being addressed by physical therapy interventions, ensuring that changes reflect meaningful improvements in patient health. Outcome measures are essential for evaluating the effectiveness of physical therapy management. They provide objective data that can be used to document progress, justify continued care, and support funding for programs. Outcome measures also help therapists refine treatment plans and demonstrate the value of their interventions to patients and third-party payers. Different outcomes are relevant and essential for all parties involved in patient care. These stakeholders include the patient, therapist, and third-party payers. Each group may prioritize different outcomes, but all must be evaluated and documented to ensure effective management and continued support for physical therapy programs. Outcome measures vary in their specificity to a problem and their evidence base. The validity of outcomes is strengthened when multiple measures are combined and consistently show change in the same direction. For example, decreased breath sounds, chest X-ray findings, and low oxygen saturation together provide stronger evidence of atelectasis than any single measure alone. Let's look at an example. If a therapist hears decreased breath sounds over the lower lobes, this is a non-specific finding. But if a chest X-ray also shows atelectasis and oxygen saturation is low, the therapist can be more confident that clinically significant atelectasis is present. This combination of findings supports the need for cardiopulmonary physical therapy. Assessment doesn't end after the initial evaluation. It's an ongoing process throughout treatment. Therapists continually reassess the patient's status, update the problem list, and adjust treatment goals and interventions as needed. This dynamic approach ensures that therapy remains effective and responsive to the patient's changing needs. Effective documentation and communication are vital in clinical management. Therapists must clearly record assessments, problem lists, goals, interventions, and outcomes. This ensures continuity of care, facilitates collaboration with other health professionals, and provides a record for quality assurance and funding purposes. Cardiopulmonary physical therapy often involves collaboration with other health professionals, such as physicians, nurses, and respiratory therapists. Interdisciplinary teamwork ensures that all aspects of the patient's care are addressed, leading to better outcomes and more efficient use of resources. Educating patients about their condition, treatment plan, and self-management strategies is a key component of successful therapy. Empowered patients are more likely to adhere to treatment, make healthy lifestyle changes, and achieve better long-term outcomes. Therapists should provide clear, practical information and support throughout the rehabilitation process. Discharge planning is an important part of the clinical management pathway. Therapists must ensure that patients have the resources, support, and knowledge needed to continue their recovery after leaving the hospital or clinic. This may involve coordinating with community services, arranging follow-up care, and providing education on home exercises and self-monitoring. A major goal of cardiopulmonary physical therapy is to prevent complications such as deep vein thrombosis, infections, and decreased mobility. Therapists use a combination of exercise, positioning, airway clearance, and education to minimize risks and promote optimal recovery. Beyond treating acute problems, physical therapists aim to improve overall wellness. This includes enhancing fitness, strength, endurance, nutrition, and mental well-being. Therapists encourage patients to adopt healthy habits and address modifiable risk factors to support long-term health. For patients with chronic cardiopulmonary conditions, therapy focuses on long-term management and adaptation. Therapists help patients set realistic goals, manage symptoms, and maintain independence. Ongoing support and education are essential for sustaining progress and preventing relapses. Therapists work with patients to identify and modify risk factors such as poor nutrition, inactivity, and smoking. By addressing these factors, therapists help patients reduce their risk of future complications and improve overall health outcomes. Reassessment is tightly linked to treatment in cardiopulmonary physical therapy. Therapists must continually evaluate the patient's response to interventions and adjust the plan as needed. This ensures that therapy remains effective and patient-centered throughout the course of care. To summarize, the clinical management pathway involves assessment, problem identification, goal setting, treatment planning, intervention, outcomes measurement, and ongoing reassessment. Each step is essential for delivering high-quality, evidence-based care to patients with cardiovascular and respiratory disorders. Remember, effective cardiopulmonary physical therapy relies on a structured pathway, evidence-based interventions, and ongoing evaluation. Always prioritize patient-centered care, adapt to individual needs, and use outcome measures to guide your practice. By following these principles, you can make a meaningful difference in your patients' lives. Thank you for joining this overview of the clinical management pathway in cardiopulmonary physical therapy. By mastering assessment, goal setting, treatment planning, and outcome measurement, you'll be well equipped to provide high-quality care. Continue learning, stay updated on best practices, and always put your patients first.